patient today has flown in from Florida. She used to weigh 350 pounds at some stage and has lost about half of her weight. And she's had some previous surgeries done back at home, and she's not 100% happy with her results. So she's seeking advice and see what we can do. So starting from the top, we have an arm issue. As you can appreciate, we have an arm lift scar that goes here, and then I think there is a J upper body lift scar that goes here. Is it the same on the other side, sweetheart? Yeah, same thing on the other side, but she still has a significant amount of skin and tissue laxity. So these need to be redone completely. I would attempt to join these two scars into one scar that comes down and revise her J upper body lift. I will do an arm lift and an armpit lift. You see, this armpit should be reconstructed at a higher position. All of this needs to be removed. We need to do some liposuction around the elbow. The problems are as follows. We have this banding or indentation here, very difficult to correct now. And also, this scar is very difficult to bring lower. But we can work with it and try to bring it as low as possible. It's not going to be as low as my typical arm lift incisions, but it's going to be better than this, and it's going to be symmetrical. And through that, we can remove a good amount of tissue. As we turn her, if I may, the back, she's got a significant amount of upper back laxity. She has had a fleur-de-lis tummy tuck, which I do not like, as many of you know. And here, the question is whether we go after this or after this. The right order, and she's had liposuction here, which has created this tightening and scarring of the skin internally. So actually correcting these are super difficult because it's not about cutting the skin. There is contour irregularities, internal scarring, excess skin. So we can go and remove the excess skin, and we have to try to detach the skin and the internal scarring from the muscle. And we may even have to put some fat in there to correct the contour. A lot of the times, by the time we do one of the procedures, many patients come back and say it's good enough. I don't care about the rest of it. And it's just because you can be chasing these one surgery after another to get all of the problems solved. But we can get a ton of improvement with just a bra line upper body lift, and that should clear up a lot of these issues. The only thing that it does, the other thing that it does, which I do not like, is the fact that it's pulling her tummy tuck scar higher. But I think it is what it is. So we have to do this surgery first before I can come back and clean up the lower half. With the lower half, she had a tummy tuck. It's a fleur-de-lis, so it's the inverted T. I'm just gonna show the scar a little bit, if you don't mind. It's somewhat uneven, obviously. We have a little bit of skin and muscle laxity this way. We have a scar that has a W to it. The pubic area is pulled more on one side than the other side. And then there is still, and to be expected because this is a tummy tuck, it wasn't a body lift. There is a ton of skin laxity of the thighs. So what I would be doing here is to come and cut you low first, to remove the scar and to even out your pubic area because it's been pulled up and scarred that way. So internally we have to release those scars and make this kind of droop to some degree, recreate the problem before we solve it. We have to do elevation of the tummy all the way up here, remove more skin here, and then with the lower incision, cut you in the front, on the front of the thighs, do a frontal or anterior thigh lift, do an outer thigh lift, and as we rotate you towards your back, clean up your previous incisions, and do a buttock lift like that. Okay, and you have a small incision right here. I think that would also be gone. All the excess fat can be utilized to fill out the dimpling in your buttocks and make that smoother. If you desire not to have it larger, we can make it smaller, but I think you need the fat back because this, let me rotate you. This cheek is smaller than this one and there's a ton of dimpling. So to get that fuller, rounder, perkier, smoother, not only I have to lift the skin, but also I have to replace the fat in areas that do not have enough fat. Okay? And then come back to your thighs again. So he told me what one area that he disliked are your thighs. So lifting this up will start helping it. Pull this up from me here if you may. And you will say, well, that's not maybe enough, not enough. If it's not enough, then I have to go after the width, do a width correction, trying to reduce the horizontal laxity of the thigh by placing an incision up here and coming all the way down here and removing the excess skin of your inner thighs. Okay? Okay. So that's what we will have to do. Thank you for sharing your story.